The following PowerPoint is an overview of the Community Readiness Model. The project is through the National Center for Community Readiness, Commitment to Action for Seventh Generation Awareness and Education, HIV/AIDS Prevention Project, CASE at Colorado State University. What CASE offers on this project is that our primary goal is to increase the capacity of an organization or community to implement HIV or AIDS prevention by offering the Community Readiness Assessment, provision of a readiness diagnostic, a readiness workshop, a Community Readiness Action Plan, social marketing strategies, and follow-up with technical support. Mobilizing the Community Readiness Model was actually developed at Colorado State University at the Tri-Ethnic Center for Prevention Research. The primary developers are Barbara Plested, Pamela Jumper-Thurman, Ruth Edwards, and Eugene Edding. The purpose of community readiness is to provide communities with the stages of readiness for development of appropriate strategies that will be more successful and cost-effective. What exactly is the Community Readiness Model? It's a model for community mobilization and change. It has 9 stages of readiness. It measures 6 dimensions or aspects of a community. Each dimension has a stage of readiness associated with it. Each readiness stage has specific interventions that work most effectively for that stage, and it integrates culture into the prevention process. Trying to implement something when a community is not ready can be costly in both human and financial resources, sometimes a waste of money, time, and effort. Dimensions of community readiness. There are 6 dimensions in the model, and each of those dimensions have key questions that are asked of those people interviewed in the community. The 6 dimensions are community efforts, which really asks questions about what's currently available as far as programming, activities, and policies, how long those efforts have been in place, and who they serve. Dimension B is the community's knowledge of those efforts. Does the community know how to access? What services are provided? What kind of evaluation is taking place within those programs? Dimension C is leadership, which includes questions about not only elected leaders, but also influential community members. This can be a key dimension within a community because leadership support and involvement can be critical for the success of a project. Dimension D is community climate, which really gives you an essence of what kind of community do we live in, what are the strengths and what are the weaknesses of that community. Dimension E looks at the community's knowledge about the issue, whether that be HIV and AIDS, alcohol abuse, methamphetamine use, and it really asks questions about how knowledgeable is the community about local issues and signs and symptoms of that concern, local data that's available to the community. And Dimension F looks at resources for prevention or treatment efforts. These questions deal with people volunteering their time, donating money, organizations making space available, the expertise within the community to deal with that issue. Those are the 6 dimensions of community readiness. These are the 9 stages of community readiness. Our first stage is no awareness. The second stage is denial and resistance. The third is vague awareness. 4th is pre-planning. 5th is preparation. 6th is initiation. 7, stabilization. 8, confirmation and expansion. And 9, high level of community ownership. With our stages, the first stage is unique in that most stages of change start with the denial resistance. Ours is no awareness because in some communities, for some issues, it is true that there is no awareness of the need to do anything at that point in time. Our second stage is denial because you have to have some information that it is a concern to deny it. But as you can see, it's as any stage model where level of intensity, level of involvement increases along the continuum of 1 to 9. Some examples of what we hear when a community is at a certain stage follow. The first stage of no awareness, these are the types of comments that we hear during our interview, is that the issue is not generally recognized by the community as a concern, or it's just the way things are, or that the issue is overlooked or ignored, or that the behavior may be expected of one group but not another. The second stage, denial or resistance. What we hear from those interviews are that some in the community recognize that this behavior is a concern. There is little or no recognition locally. There's a feeling that nothing needs to be done. Comments of "it's not our concern" or "we can't do anything about it anyway." The third stage is vague awareness. There's a general feeling by at least some in the community that there is a local concern and that something should be done about it. However, at this point, there's no immediate motivation. There's no identifiable leadership for this cause. The community climate does not seem to motivate any action, and the issue and causes tend to be stereotyped. From these first three stages, you can see that the increase in motivation and awareness and involvement continues to increase throughout the three stages. The remaining stages continue to do that, and the full list of those types of key markers are listed in the manual, but just as an overview to kind of give you a sense of what each stage relates to. It is important to remember that this community readiness model is based on the community's truth, and that sometimes there's a struggle between the community's truth and what the reality is within the community, but that a person and a community's perception is their reality, and that sometimes these two differ. In a regular assessment within your organization, you are probably getting at the truth, and you're setting strategies based on that. This model gets at the community's truth, since you're trying to do community interventions, that you must know their truth so that you know the strategies to incorporate, because they will be more successful when you know the perception and beliefs of your community. The process for using the community readiness model is a simple process. The community or group that's interested in using the model identifies the issue, which can be child abuse, domestic violence, head injuries. The list is infinite on what the concern or issue may be within the community. Once that is identified, then to define what your community is. Is it the entire town or city? Is it divided up by zip code or region? Is it a group within your community, such as law enforcement or social workers? Is it an age group, youth to elders? So defining the community is important in setting this model into place. Once that is done, you conduct the key respondent interviews, and there are roughly 28 to 36 questions depending on the issue that you select, and those interviews can be completed in a half an hour to an hour. They are generally done by phone, sometimes face-to-face. What we recommend is to not send the interview questions ahead of time to those that will be interviewed, because what will happen is they will go and find the truth and the correct answer. What we want from this interview is people's perceptions and beliefs about what's currently happening and going on within the community. We conduct 6 interviews within each community. And once those interviews are complete, there's a scoring process that the community would go through, and it's really reading each interview and scoring them on the stage of readiness for each of the 6 dimensions. And within the manual is a whole outline of that, and not only in written format, but also in a audio tape if you want to listen to it. Once those readiness scores are determined, the community can conduct a workshop with key people within the community to look at those scores and develop strategies that are appropriate for the level of readiness. And the ultimate goal is community change. The following is just an example of a community diagnostic that comes out of those interviews and the scoring process. As you can see, we can Let a community know that Dimension A, which is the efforts, scored at a 6, initiation, which on that scoring means that the community has things in place from the community members' perception that have been running and that are available related to HIV and AIDS. For Dimension B, knowledge of the efforts, the community is at a pre-planning. They know the names of each of those efforts that are available in activities, but their knowledge is limited after the point of what the names are as far as what kind of services are offered, how to access, and who is appropriate for those services. Dimension C, leadership. From this community diagnostic, it would be clear that the leadership is at vague awareness and probably may be able to speak about the issue, but really isn't involved in any type of committee or group that is really actively trying to address this concern. Dimension D, community climate, is at vague awareness, which means that the community right now probably is dealing with other issues, has concerns that do not relate to the concern of HIV and AIDS, and probably that dimension would be one that the community would want to address. Dimension E, knowledge of the issue, is at denial, which means that for HIV and AIDS, when we asked those questions, it appeared that the community overall does not know signs and symptoms, isn't sure about routes of transmission, does not know local data on how many people may be infected with the HIV virus or have AIDS, and that may be a dimension that the community would want to address in developing strategies. And Dimension F, resources, is at a 5 preparation, which means the community does have some resources available as far as organizations giving space and people volunteering some time. What we would do with this diagnostic during a workshop is have the community select 2, possibly 3, but 2 dimensions that they'd like to address at this point in time. And we usually suggest the lower ones. And for this one, we would recommend Dimension E, knowledge of the issue, and C, leadership, and look at the strategies that would be appropriate for those dimensions and setting an action plan that fits their community. Each community readiness score has strategies that will be most effective at that level. Following are some examples of the types of activities or interventions that communities have told us have been most effective at those stages. At No Awareness, Stage 1, the goal would be to raise awareness of HIV and AIDS. Strategies that can be incorporated at this stage are to identify potential supporters who may be helpful in implementing strategies, visit with them one-on-one, present the information at existing or established small groups, do a search online for resources such as posters, educational information that you can duplicate or order. Make phone calls to your friends, inform them, get them excited, and solicit their support. Be creative. As you can see, when a community is at Stage 1, no awareness, it is the time to visit with people one-on-one, talk with family and friends, get people's support. It is not the time to be sending out mass mailings, group emails, because people will delete and not read that information because there is no awareness. So visit people one-on-one, get your family and friends involved. The second stage, denial and resistance, your goal will be that this issue does exist in our community. The strategies that you can incorporate at this level of readiness is to always remember to continue strategies from previous stages, and then meet with people who are likely to provide HIV or AIDS services, such as those in the medical profession, substance abuse treatment providers, mental health, etc. You can distribute flyers, brochures, educational information, but remember that that information needs to be brief and concise. Get the facts out, get the information out, but not in a long narrative, because at this level of readiness, people will not read a lot of information on it. Put information in church bulletins, newsletters, whatever is available within your community. Choose a place that will likely be seen by the community members. We have found that church bulletins are an excellent way of getting information out. Remember that media must be low intensity but visible. At this level of readiness, posters and billboards have not been that effective in communities. People tend to walk right by them. At Vague Awareness, Stage 3, your goal will be that the community can make positive changes. The strategies to use, again, you can always continue those from the previous stage. But in addition, attend or have a booth at special events, such as potlucks, dances, health fairs, where you can distribute the information that you've gathered. Identify all potential local data sources, programs, and efforts. And this may take some time in getting local data, so be persistent. Focus on topics that the community may be more ready to address that are related to HIV infection, such as underage drinking, methamphetamine use, STIs, or substance abuse in general. At this stage, you can publish newspaper editorials or articles and create media that is consistent with the community's visibility, things that might be read. These are the strategies for the first 3 stages, and each stage has strategies, but for the purpose of this PowerPoint, we will just cover the first 3. Again, you can read those in the manual or on the audio of the manual that's available online. So our take-home message for people that are using our model is that we believe and know that interventions must be appropriate for the community's stage of readiness and the culture of that community. Over the last 18 years, these are some ways in which the Community Readiness Model has been applied for drug abuse, alcohol use, intimate partner violence, child abuse, head injury, environmental trauma, transportation issues which related to miles traveled within a community, cultural competency within an organization, HIV and AIDS, suicide prevention, environmental and weather conditions, animal control issues, and many more. Some of the successes of the Community Readiness Model are that it has been used in over 2,100 communities throughout the United States. It's been used internationally as well as nationally. The manual has been translated into both Chinese and Spanish. It's been used in the context of research, evaluation, and grassroots efforts. It's been the focus of over 40 published articles in this country and others. And recently, the World Health Organization has funded 5 countries to use our model in looking at child abuse and neglect. If you would like information on the community readiness training or from the technical assistance team, please contact Barbara Plested at bplested@aol.com, Pamela Jumper Thurman at pjthurman@aol.com, Martha Burnside at martha.burnside@colostate.edu, and that's at colostate.edu. Andrea Israel at andrea.israel@colostate.edu, or Irene Vernon at irene.vernon@colostate.edu. And so again, this PowerPoint was created by the National Center for Community Readiness, Commitment to Action for 7th Generation Awareness and Education, HIV/AIDS Prevention Project, CASE. Our website is www.happ.colostate.edu.